Hello everyone, my name is Dr. Prashanth Arun, consultant physician and diabetologist at MV Hospital for Diabetes, Roypuram. So today we are going to be seeing about diabetes. So many people don't take diabetes very seriously, but having a high blood sugar and not maintaining your sugar under control can lead to complications due to diabetes like diabetic retinopathy, diabetic nephropathy, diabetic neuropathy, etc. So to avoid these complications, it is always better that you keep your blood sugar well under control. So when you say keeping your blood sugar well under control, maintaining your HbA1c less than 7 or 6.5, keeping your fasting blood sugar less than 120 and keeping your postprandial, that is your after food blood sugar, less than 160 is always better. Always go meet your physician and get your medicines altered accordingly. Always check your sugar levels if you are taking medicines for diabetes, or in case you are a patient with diabetes, always check your sugar levels at home. Don't keep it like only you check diabetes when you go to the hospital. Always when you are at home, check your sugars, use the glucometer and check your diabetes at home, monitor the blood sugars and write it down so that it will be easier for the doctor to adjust your medicines. And when you check your blood sugars, maybe one day you check in the morning, one time you check before lunch, after lunch, one time you check before dinner, after dinner, because you have diabetes all throughout the day. It's not only the fasting postprandial. Your 24 hours, all your blood sugars are really important. And by keeping all your blood sugars well under control and maintaining a 3 months average less than 7, you can avoid complications due to diabetes. Many people ask us, do I have diabetes? How do I test if I have diabetes? Always, to know if you have diabetes, it is always best that you do the GTT, the glucose tolerance test. That is, if your parents have diabetes, either your father or mother has diabetes, it is definitely you are at risk of developing diabetes. So check your GTT. And in case you are a person who is obese or you have a central obesity and your parents have diabetes, definitely from now start taking precautions to lose your weight, stay on a fit diet and eat properly, healthy, and regularly you work out. By doing all this, you can actually prevent developing diabetes. And for people who have diabetes, many people ask us whether once I start my insulin, should I have to continue the insulin regularly, or can I discontinue the insulin, or when will I be able to come out of the insulin? So in case you are a patient with diabetes and if your blood sugar is not under control with OADs, that is the tablets, and your doctor is suggesting you to go for insulin, definitely go for insulin, because earlier you start the insulin, you can avoid the complications. Next, you can preserve your beta cells, and once your sugar is under control, definitely your doctor will be able to switch you out from the insulin to tablets. Few patients may need to continue the insulin, but definitely continuing insulin is not bad, and definitely insulin is not going to cause anything bad for the body. So definitely insulin can be taken safely. By taking insulin and tablets, meeting your doctor properly, keeping your blood sugar well under control, definitely you can avoid complications which are coming because of diabetes, like as I told you, the diabetic retinopathy, nephropathy, neuropathy. And one more thing people with diabetes have to be very careful about is wearing proper footwear, because most of the people with diabetes who have diabetic neuropathy have no sensation in their feet, which actually what happens is when a stone or thorn picks, they will not know and they develop an ulcer, and most of the patients are not even aware that they have an ulcer. So always, people with diabetes, examine your foot well, wear proper footwear and take care of your feet also. Thank you.